I no longer feel that I can be quiet about the things that are going on. I actually feel like I'm living in the movie Idiocracy right now. There's some discrepancies between the things that we're hearing in the mainstream media and the way that we're living our lives right now. What we do know is that this COVID virus mostly affects the elderly. We know some children have been affected. There have been a couple of deaths. I want to talk about the statistics just from the Austin area because that's where I am. I know there's been about 2,000 reported cases currently and about 60 deaths. And we've been on lockdown in the city of Austin for almost 60 days now. And what doesn't quite make sense about the entire city being locked down is not only the way that we're reopening, and I'll get to that, but the 60 deaths, okay? So 60 deaths are caused by this virus in a city of 1.2 million people, which is an extremely small number. And my heart goes out to the victims who have suffered the illness. My heart also goes out to the families who have lost loved ones to this. But I've worked in children's hospitals before. I've worked in regular hospitals, and I know that there have been days where I've lost 2 or 3 patients in a day, and that's just on my unit. Premature infants die daily. There are deaths from cystic fibrosis, leukemia, cancer, suicide, child abuse, domestic violence. I mean, there's all sorts of things that people die of, and this number, this COVID virus, seems extremely small. I understand that it is contagious, but what we know is it's also not airborne. And so it doesn't really make sense that an entire city or country, an entire globe is on lockdown for 60 days. We know that if you have the virus, then it has like a 2-week quarantine period, right? So I think most of us were thinking when we quarantined that it would be about 2 weeks to determine who had the virus and who didn't, to treat the ones who had it, to quarantine those that could potentially, have it from travel and things like that, and then resume life as normal. That makes the most sense. 60 days, what does that matter? You either have it or you don't. If you have it, you should have already had it. If you don't have it, you're still at risk for catching it when we resume life to normal. What's the timeline here? How long are we going to be on lockdown? And it's not just that we're being, forced to stay in our homes. The shelter-in-place orders seemed quite ridiculous at the front end, but what I'm concerned about is the effects of this on children and families. The leading cause of death in Texas annually is suicide. And what doesn't make sense to me about that is that, we've got all of these people with mental health issues, not just in Texas, but across the entire United States. And we've decided that it makes the most sense for the well-being of our citizens to take people with mental health issues, lock them in their homes or tell them to stay home. Make it difficult for them to access their meds, make it difficult for them to go for a walk. They don't have childcare anymore, so they're locked in their homes with their families and their young children. They're not able to access their chiropractic care, their massages, their counselors or therapists, whoever it is that they typically see that helps them with that mental health. And they're also isolated. We're depriving people with mental health issues of human contact. And what we know about human connection is not only is it vital for our survival as humans. I mean, an infant that doesn't have human touch can actually enter failure to thrive and die because of lack of human touch. And what we've done now is begin to put policies in place that reduce human contact, not just in the infant level in NICUs and when children are born are reducing contact, but we're reducing human contact everywhere. Restaurants, bars, airports, schools. We're taking children out of school, and for some of them they're leaving homes where perhaps it's a toxic, dangerous environment at home and they look forward to going to school every day. And we've taken them from school for 60 days right now and potentially more. I read an article today where 3 children have died of COVID in New York. 3 out of the entire city of New York have died of COVID. I can mention 3 kids in a day that died of cancer that I know, that lives that I mourn every day. But that wasn't a reason to shut down the global economy and to pull every child out of school. And for some of those children, yes, school is a safe place. They look forward to seeing their principals and teachers and coaches every day, but also the children with special needs. They're losing out on their daily interventions that they need. Think about children with autism, Asperger's, cerebral palsy, Down syndrome. These these kids need those services. They're missing out on services for kids with dyslexia, and you know, without those kids, you know, getting the services that they need, they're falling behind in the progress that they've made to overcome those learning disabilities. Now, we also have teachers who, you know, their entire reason for getting out of bed every day is to spend time with their students, and now those teachers are at home. Sometimes, you know, they might be able to reach their students on Zoom meetings and go-to meetings and things like that. But if you've watched some of these students on the Zoom meetings, they're not paying attention. They're not learning. We've got kids that are going to fall behind in their education, kids that are suffering developmentally, physically, brain development, their play. They're missing out on sensory play and sensory experiences. They're missing out on vitamin D and fresh air. This isn't healthy for an entire society to be on lockdown for this long. And what's the timeline? Like I said before, this isn't going anywhere. We have to learn to live in coexistence with this virus, because it's here to stay. It is going to continue to spread. And we know that you know, there was a test done of like 400 people who tested positive for the virus that showed no symptoms whatsoever. We know that the death rate is extremely low. We know that it spreads quickly, but we also know that it's not airborne. We know that, you know, we're told to wear masks, but yet restaurants are open. I just drove past an Austin restaurant that's open and everyone's social distancing from the other tables, but yet they're all at a table with, you know, 5 or 6 of their friends, and they're wearing masks that they have around their neck while they eat. What happens if that person, while they eat, sneezes on the table? Are we gonna Lysol the entire restaurant? We can't do that. We have to continue living our lives. We have to be able to treat this illness if you catch it. If you are immunosuppressed or elderly, or again, kids with cystic fibrosis and cancer, asthma, stay home. We will do our best to bring things to you, but the rest of us, our entire society, generation of children are suffering from this. Not just people with mental health issues, which again, the rate of suicide, domestic violence, child abuse, sexual abuse, rape, crime, theft, drunk driving, all of those rates are going to go sky high. And we are damaging an entire generation of people by moving towards a digital age where we are reducing human contact. We know that human contact is not just needed to survive, but it increases your lifespan. It decreases your cardiovascular, your risk of cardiovascular death. It decreases your risk of Alzheimer's. We know that about human contact, and yet as a society, we found it completely acceptable to move into a shelter-in-place, lockdown, isolation from other people. I don't know about you, but I'm a toucher. I crave human contact and human touch, and I don't want to raise my children in a world where they are scared to touch people, where they're scared to go outside, where they're scared of this mysterious germ that's out there. We also know that the germ came into the United States about November or December, and we resumed life as normal for several months, 2 or 3 months even, and it didn't spread. It didn't become a thing that any of us know about. My kids had a viral infection in January. They were having trouble breathing. They had high fevers. I gave them meds, vitamin C, turmeric, cooked mushrooms and garlic, and they overcame it on their own. I never caught it, and nobody else did. It may have been COVID. I don't know. I don't know what it was, and that's what I was hearing from doctors. We don't know what it is, but they're fine. And I know that there are some people who are not going to be so fortunate as to overcome the disease, but we have to be able to face this. We have to be able to band together as a society and decide that we are not going to let the government become our shepherd and we become the sheep. We have to think for ourselves, that we have to band together, and we have to act out. Right now, this does not feel like we have free speech. We're being robbed of our personal liberties. We're being robbed the right to work and feed our families. And like I said before, an entire generation is going to be suffering the effects of the way that government is handling this and reacting to this crisis. And I have a feeling that Big Pharma is going to profit huge from this scare. They are using fear to scare the American people, to rob them of freedom of speech, and to make them act like sheep and follow every little policy and rule and law that they have in place that is not for the well-being of people. We've had doctors come out and say, stop wearing masks. You are risking carbon monoxide poisoning. You are increasing the risk that you will touch your face more and possibly get the COVID infection. We know that it's not good for you to wash your hands every day. We know that it's not good for you to overclean your home every day. We know that we are putting the people at a higher risk of catching the illness with the procedures that they've put in place. We know that we need to be able to build a herd immunity and work together to fight this virus. It's time that we stop being quiet, that we speak out, and we do what's right as the American people who want our personal liberties back and want our children to grow up in a world where it is safe to play outside and it is safe to love, hug, and touch one another. Please like, comment, and share this video and spread the word. Enough is enough.